Wearing a lampshade for entertainment purposes only, it's the Medicare for the Lazy Man podcast. The Medicare podcast that fights against one world government. And now he might have joined Toastmasters if he weren't so bashful, Medicare expert Doug Jones.
Well, good day, ladies and gentlemen. Welcome to another episode of the Medicare for the Lazy Man podcast. Oh, I'm so lazy, I barely made it through the title of my own podcast. Thank you so much for joining us today. We're attempting a Herculean task, and that task would be helping you feel very, very confident that Medicare is going to be a positive change in your life. And when you approach Medicare, if you have one or two or possibly three decisions that you make in the correct direction, you will spend the rest of your life with the finest coverage available, known to mankind, the finest health insurance, and your cost will be very reasonable for that. Your risk of loss will be very, very low, and your enjoyment of medical expertise will be very high. So how do we do all of this? Well, I explain it in my books. My primary book, the flagship of the fleet, is called Medicare for the Lazy Man. The current edition is 2025. But if you go to Amazon or Barnes & Noble and search Medicare for the Lazy Man, you might, by the time this episode is published, you might find that the 2026 edition has been published. I don't know if I'm going to do Barnes & Noble anymore. There have been very low sales, and they won't let me promote the book on their site, whereas Amazon encourages me to promote the book on their website. So it might be that we're just going to stick to Amazon from now on. But in any event, you're going to find a book that in a short period of time, the length of time it takes you to drink a couple of drinks of the alcoholic variety, I would assume, you will find that you have gained spectacular Medicare knowledge that is going to help you avoid pitfalls and enjoy the finest that the Medicare program has to offer. So that's Medicare for the Lazy Man. 2025 is out now. 2026 will be out before you know it. The other two books I have are designed to be more specific instructional tutorial manuals. One of them will help you select the proper drug plan on the U.S. government website. That would be Medicare Drug Plans, a DIY guide. That book is on Amazon.com in paperback, Kindle, and Audible formats, so you can read it in the paperback version. You can read it from your Kindle reader, or you can listen to me tell you how to select your best drug plan from all of the drug plans available to you. And that's become a more important and more critical function because the sources of reliable assistance for people who don't know anything about the insurance business is drying up rapidly. Good people in the insurance business are finding themselves unable to help people pick a drug plan. It's become a huge economic financial burden for businessmen who are not being paid anything for their help, and they're not allowed to charge a fee for that service in some districts. I don't know. I've never even thought about charging a fee. I've tried to reach out and help people through the method of writing this book to help. I know a highly respected a Medicare expert that is preparing a slideshow. Oh boy, what is it? There's a methodology that people put together slideshows that theoretically it's PowerPoint. That's what he's doing. He's doing a PowerPoint show to help people use the government website to pick out the best drug plan available to them. But my resource, for those of you that have a more challenging drug regimen, my suggestion would be send me an email asking me for the link to the subscription service, and I will send you a link that will give you a discount if you decide to use their service. And I think you're going to find their service is very sophisticated and very broad in scope. Their options for discounts are much more numerous than I'm able to provide. And they are also scanning larger numbers of pharmacies. I have to ask people to give me two or three pharmacies that you might want to shop at, whereas they will automatically scan a much larger number of pharmacies in your area to see if there are in-network drugstores that will provide a better price, a better out-of-pocket cost for the insured person. So that's Medicare drug plans. It's become a big, big problem, and I want to help as much as possible. I can't afford to do it for everyone. And then the book that I think most people are going to, people new to Medicare will find the most value in is right now it's entitled Medicare for the Lazy Man Bare Bones. But I'm going to change that title, redesign the cover so that it says something like Medicare Enrollment Guide. And Stalker Susie suggested that I add another phrase to that, an explanatory phrase, and that may happen. We'll see how crowded it gets to be on the cover. But basically, it's a tutorial for enrolling in Medicare. After people read the book, the Medicare for the Lazy Man book, they often ask me, okay, what do I do next? And I have to tell them, well, you can go back and read chapters 4, 5, and 6, or here's this small book for free that will tell you exactly how to enroll in Medicare. If you send me a message to the email address that Randy's going to give you at the end of the episode, I will be happy to send you free a photocopy of my book. It's not the actual bound paperback copy, it's a photocopy of that, but it's got the content from page 1 to whatever, it's not very long, but it is packed full of powerful information about enrolling in Medicare. I think you'll find it very useful. So I think I'm getting better at whipping all this knowledge out quickly. Either that or I've forgotten to say a few things, but I would like to introduce my partner in crime, Randy Carson, who has just been waiting. He's just been waiting eagerly for his opportunity to take over the mic and entertain you for a while. Hello, Randy.
Well, good morning, Mr. Jones. You're looking bright-eyed and bushy-tailed today.
Oh, boy, I keep telling you, don't look at my bushy tail, please. It's very creepy, very weird.
Oh, my gosh. Well, I've been talking to a lot of people, that listen to our podcast, and certainly one of them is Stalker Susie, which we love her to death. But did you know, Stalker Susie, that Doug has an alternative job? He makes a lot of money off of it, and the name of the company is a family owned since 18 when did you
I don't know. It's upside down when I read it.
Okay, well anyway, it's the Jones Manure Hauling Company.
Not just any Jones, it's the D Jones.
The D Jones, and that's because your name's Doug.
Because I'm a guy.
Oh, I pulled him out from underneath his Corvette. He was working out this morning, and I saw that T-shirt, and I'm going, I don't know how I'm going to get through the podcast staring at the manure handling and delivery company. But anyway, I do have something that I should mention early on here, and that is that I've got probably the best chance I've ever gotten to handle this in my own sort of way. One of the things that we have is, identify in terms of your Medicare, what they'll pay for 2025.
Yep. Your
Yeah.
Medicare Benefits 2025.
Yeah. So we're coming up into the end of the alphabet.
We sure are.
And one of them, right at the end of the alphabet, and one of the things they'll pay for is X-rays. Okay, we're going to talk about that today, but I'm also wondering, Doug, will they pay for xylophone lessons?
If that were the case, we would have one more day's worth of your Medicare benefits. But in this case, I don't see that. Just like dancing lessons, xylophone lessons have disappeared from the big book of what Medicare is going to cover.
Oh, darn it. I've always wanted to play xylophone too. Well, how am I going to do it now?
I think it's probably Doge. It's probably the new order in DC of strip it down, slim it down. Let's not waste the taxpayers' money. So they've probably gotten rid of a lot of stuff. That book was huge. Your Medicare Benefits 2025. I don't know how many trees I had to send to the sawmill, but they made me cut down my own trees in order to make the paper that thing used in my printer. It is just hefty. Hefty.
That's terrible. That's terrible. Well, so I know we need to make some money today, and one of the other things that we usually get into, I think it's the next section, is talking about why the 14 reasons why you don't want to go the Medicare Advantage route,
Well, I'd like
and
to know
and
where that
I
is.
would just and I would just like to point out that you don't want to deal with Metacrooks at all, and that is Part C,
There you go.
Metacrooks,
Because
Metacrooks.
Metacrooks are Metacrappy.
Yes, absolutely. So I'm going to go and mute out, and I'll let you
Alrighty.
make these bundle. You're going to be pulling it in by the wheelbarrow today. I can tell.
Well, geez, yeah, that's what the company is all about. Medicare and manure, all in the same half hour. All righty. Well, here's the way we always start this. The first segment I like to do is the Medicare Minute, Medicare Advantage Minute, where I spend less time than I should telling you about all the pitfalls of Medicare Advantage. If I told you everything about Medicare Advantage that you should stay away from, that would be all of every episode. So we try to limit it to just a short period of time in each episode so that just as you're reaching to turn off the switch, we actually changed the content to something maybe more interesting. So here's the headline on today's Medicare Advantage Minute article. Physicians say that prior authorization stands in the way of medically necessary care. Physicians surveyed by the AMA, the American Medical Association, say that prior authorization can cause delays or force patients to abandon treatment. They warn that denials could increase as insurers adopt AI in order to review claims. Physicians can say that prior authorization continues to pose barriers to offering timely and medically necessary treatment, according to a new survey from the AMA. Nearly all of the physicians surveyed in December said that and this was December a year ago, so this article took a while to compile the information from the survey. Prior authorizations resulted in care delays at least some of the time and had a negative impact on patient clinical outcomes. Most respondents said that prior authorization denials had increased over the last 5 years, with nearly a third of respondents reporting their requests as often or always denied. Physicians reported concerns denial rates could grow further as insurers adopt artificial intelligence tools to review claims. So, the insight of this article, almost 1 in 3 physicians surveyed by the AMA said that prior authorization criteria are rarely or never evidence based. The majority of respondents said that prior authorizations led to overall higher medical utilization, with 77% of physicians reporting that patients had to first attempt an ineffective initial treatment. In other words, before they'll give you permission to do the treatment that your doctor wants to perform, to fix you, to cure you, to make you well, they might often force you to take an ineffective or an inferior treatment to see if that works, because that treatment would be cheaper and save the company some money. At times, prior authorization can lead to care delays that significantly impact a patient's health. More than a fourth of physicians said that prior authorization led to a serious adverse event for a patient in their care. 23% reported a patient was hospitalized due to a prior authorization problem, while 18% said prior authorization contributed to a life-threatening event, and 8% said that patients suffered a disability because of it. Physicians are concerned that prior authorization denials could accelerate in the coming years if more insurers turn to AI to review claims. While major insurers, including Blue Shield of California, claim that using AI to review prior authorization documents will reduce the burden on physicians by providing near instantaneous decisions, the AMA is skeptical that the tools will benefit providers. In a press release accompanying this survey, the AMA cited a Senate report from October that found that AI denied claims up to 16 times more than when a human reviewed the claims. Emerging evidence shows that insurers use automated decision-making systems to create systematic batch denials with little or no human review, placing barriers between patients and necessary medical care. That's the president of the AMA talking. Lawmakers have expressed interest in overseeing the insurer's use of the tech and several insurers have been sued over their use of algorithms to review claims. Still, it's unlikely that insurers will back down from using this technology. Experts previously told the publication in question. Instead, it's more likely that providers will need to adopt their own AI to submit claims. And this is kind of especially scary because the U.S. government has set up a 5-year test program in which they're going to use prior authorization as a test model in 6 different states for some procedures that Medicare currently covers without any prior authorization requirements. I don't want to see this become the first step towards managed care, because one of the beautiful things about Medicare Advantage about Medicare with a Medicare supplement is that there is no managed care aspect to it. Your doctor and you make all the decisions about what's medically necessary for you, and that's what Medicare pays for. Alrighty, moving on to Randy's favorite book, which I'm going to be able to take a forklift and load that thing up and take it out to the dumpster now that we're through with it. This is the last item in the big book of what Medicare is going to cover, entitled Your Medicare Benefits 2025. Now, if you've got a printer that is in need of something to do and it's got a couple of days of downtime, what you can do is download that book from the Medicare.gov website and then tell your printer to print it out for you. And it'll take it, maybe a couple of days, but it will be a complete list of everything that people have figured out for Medicare to cover that a doctor might want to do for you or to you. The last item in the book is X-rays. Part B covers medically necessary diagnostic X-rays when your doctor orders them. See, I'm always having to remove that part where they say other healthcare provider. I don't care about any other healthcare providers. Let's just talk about your doctor or maybe your doctor's staff. So what are the costs for this? After you meet the Part B as in Bravo deductible, which is $283 in the year 2026, you will pay 20% of the Medicare approved amount unless you are smart enough to go to Doug Jones and purchase a Medicare supplement. That's what it says right here in the book. In a hospital outpatient setting, you would also pay a separate facility copayment. So for more information, go to medicare.gov/coverage-x-rays, and that will be the source of information for diagnostic X-rays, and that will be the end of the line for our segments on Your Medicare Benefits 2025. Now, I do have a little quiz for Randy. He likes quizzes, and he's always trying to embarrass me with esoteric trivia that I fail miserably at. So, frankly, it's an ego boost when I can turn the tables on Randy. So I'm going to ask him if he knows the top city for early career physicians. In other words, if you're going to graduate from a medical school, where should you go to begin your practice? I've got a list of 15 cities here that should be the best places for new physicians to establish themselves. It's from Medscape, and I'm just wondering, let's see, it says this is a report on the best cities for young physicians to start their career based on an analysis of factors ranging, and Randy needs to know that so he can order his thinking properly, ranging from compensation to local cultural life. We want our doctors to have excellent cultural life, don't we, Randy? Yes, we do. Yes. He's nodding his head silently. Yes, we do.
Yeah,
yes,
I do.
Yes, Master.
Absolutely.
I shall do for what you say, Master. Okay, so like we give a crap about the doctor's cultural life, but there's a list of 15 cities that this study is recommending that new doctors relocate to. Any idea what's number one on the list?
Boston.
No, sir. It's never going to be Boston. I'm sorry.
Why can't I ever get a point with Boston? What's the matter with Boston?
Boston is a wonderful, wonderful place. It's full of wonderful, wonderful people. I don't think Massachusetts has one congressman that is on my side of the aisle anyway. But other than that, it's got the John Hancock. I was branded on my butt the day I was born with the John Hancock logo. In any event, Austin, Texas.
Austin, Texas.
That's right. That's where they're saying new
Okay.
doctors ought to go.
Now, okay, so new doctors need to go to Austin, Texas because there's no competition, less
N-
competition,
n-
or
Well, the two criteria that I gave you were it's an analysis of factors ranging from compensation to local cultural life.
oh well then I've got a different guess then.
Okay, what's that?
Herman, Nebraska.
What is there in Herman, Nebraska that's going to be helpful to a new doctor?
Nothing, absolutely nothing. It's got a population of about depending on how far you count out from town, maybe 300 people.
Oh,
No
well,
no competition.
and no culture, so they can
No cult,
concentrate
no
on
co
their,
no competition, no culture,
they
and
can,
they mostly pay their medical bills with chickens.
that's what a new doctor wants to hear. That's how's the IRS going to come after you when all you're reporting is chickens on your tax return? Okay, so here we go. Here are the 15 cities. Most of these places I wouldn't mind relocating to if I had to. Austin, Texas is numero uno. Then we have Salt Lake City. Salt Lake City's a little chilly for me. Charlotte, North Carolina, Orlando, Raleigh, Denver, Houston, Minneapolis. Ugh, no, thank you. San Jose, Jacksonville, Florida, Seattle, St. Louis, Phoenix, Cincinnati, Green Bay, Wisconsin. So some of those places are more palatable than others when it comes to the weather.
That's a really odd list, but there's some similarity between those cities, at least in my way of thinking.
They all seem to be fairly vibrant. What similarities did you
No,
discern?
I thought they stood on the other side of the aisle from us.
Well, I don't know. When you think about Salt Lake City, for a big city, that's probably the closest to being, on our side of the aisle. Oh boy, my bottomless pit of a garbage can has swallowed it up. I'll never be able to get it back now.
Well, one thing I wanted to mention, before we, move on too far was most people think that AI stands for artificial intelligence.
I think that's what they want us to think. What do you
In in
suggest that
the in the context of Medicare business, Medicare
Uh-huh.
knowledge,
Yes.
Medicare Advantage,
Yeah. Yep. Yep.
specifically Medicare Advantage. You know what it
Yep.
stands for?
Please tell me.
Artificial insurance.
Oh yeah, it's not your real insurance. It's your fake, yeah, pretend insurance.
It's pretend insurance because you don't get any insurance unless they decide they're going to give you some and the expenses are such that they can.
Yeah, if they open up the checkbook, then you may get your bill paid. Otherwise, your doctor's going to be up the creek without a paddle because it's the insurance company that decides whether or not he gets paid for his services. Here is some correspondence. This is from Steve. And Steve, I believe, has been a client of mine for at least a year, if not more. So I'm starting at the beginning of our exchange of correspondence, which is in November of this year. Steve the lazy man is back, he said. Ha ha ha. I'm sure you hear this hundreds of times every Medicare renewal season from lazy people like me. He said, I need your help and advice again this year, if you don't mind. I'm happy with the Medicare and Medicare supplement coverage that you got me last year. United American is working out well for me. And you may have helped with a drug prescription plan, but I don't recall. Anyway, do you suggest any changes for me? I'm not sure whether the United American monthly cost will, or what it will be next year. I'm not sure what the United American monthly cost will be next year, but I assume that it'll go up. Do you know what I should expect in 2026? And then he said, I'd like to add dental and vision for 2026. I think they're often combined. Do you have any suggestions? And I said, hello again, Steve. Good memory. I helped you enroll in the WellCare Value Script drug plan last year, and I have not heard that that plan intends to make any unpleasant changes for 2026. You can always check their website for a copy of the annual notice of change, the ANOC, which foretells the future. When this arrives in the mail in September of each year, it's a good idea to spend a few minutes reading it to avoid surprises. Now, I have attached a document with a couple of links to highly regarded dental with optional vision plans. You may use these links to check out the benefits and costs and to enroll if you like what you see. If not, there are plenty of other dental options out there. And then Steve said, "Thank you, Doug. I'll get back to you in a day or two. Do you suggest any changes for me? Not sure what the United American monthly cost will be next year, but I assume it will go up. Do you know what I should expect for 2026?" And then he said, "I took the dental coverage from one of the companies that you sent." So I said, "I have no idea what the rate increase, if any, will be in 2026, but I anticipate it will be higher than anyone likes because medical inflation is still a fact of life. As you know, my favorite plan is high deductible plan G, and it is going to have a smaller and less frequent rate increase than the plan G will have. You may be okay for a few years, but I look forward to the time when rate increases irritate you enough that you will give serious consideration to my suggestions. Until then, have a happy Thanksgiving." This was a month ago. And Steve said, "Okay, you did make me laugh for real. Thank you. I'll change my election to the high deductible plan G and see how it goes for 2026 and beyond. By the way, you are wonderful to work with." Well, now I'm blushing. He sent smiley emojis. But I have to say that I don't know what he meant by "I'll change my election to high deductible plan G," because in order to do that, he's got to tell me. I believe he's going to say, "Doug, you're my agent. I need to have you help me change from my current plan G, which has big rate increases, frequent rate increases, to high deductible plan G, which is likely to have very small rate increases and very infrequent rate increases." And so when I get the word from him, I'm going to help him make that change. Until then, I guess no news is good news. And now we get to the part of the episode where I get to ask Randy some trivia about Christmas time. It's our Christmas quiz. Randy, are you ready for a Christmas quiz?
Ho, ho, ho.
I guess that's a yes. I'm going to take that as a yes. What was Tim Allen's character's name in the movie The Santa Claus?
Well, he was Santa.
Really? Interesting. I didn't realize this, but the movie's name is spelled with an E at the end of clause, like a legal clause.
Yeah, the whole scheme is that Santa's job every once a lifetime, Santa's job is given over to a new Santa, and that Santa, who in this case was Tim Allen, had to sign a contract
So
to
he
be
regular
to be
Santa gets to go bask in a warm, sunny
yeah.
climate somewhere.
The old Santa gets to retire and go do fun well, Santa Claus is a fun thing to do, but he gets to go live in, Florida someplace and, on the
Uh-huh.
beach. But anyway, so that was the reason for the clause with an E because
Okay.
Tim signed up with as the new Santa, and then the whole movie was about him trying to convince the rest of his family that he was really the new Santa.
Wow. Well, I should probably watch that movie. I love Tim Allen's work for the most part, but I have not really sat through this movie, and I probably should do that. When I'm doing a holiday Christmas marathon, movie marathon, my two choices are going to be A Christmas Story. Is that
Yeah.
the, yeah, with going to shoot your eye out because that pretty much
Yeah,
happened
yeah,
around my house,
yeah.
and Bad Santa. I
Yeah.
love Bad
Yeah.
Santa.
So, Christmas Story, here's your trivia question.
All righty.
The little brother that spent
Yes.
most of his life underneath the sink in that movie,
Yep.
what was his name?
Oh boy, I don't remember. I just do not remember.
Randy.
Oh, really? Wow. I'm sorry. Geez. Okay. Well, I'm going to retain that now next year when you spring that on me again. I hope I'm able to recall that fact. Which country began the tradition of putting up a Christmas tree?
I'm going to have to say Germany.
Well, you'd be right on the money there. According to historians, the tradition began in the 16th century, which is the 1500s, when devout Christians began bringing trees into their homes and decorating. What the hell? You'd think I was insane if I just decided to go out and drag a tree into my house for no reason. But yet they
But you know
turned it
something?
into a,
You know something they didn't have?
what's that?
And it took them what? You said that was the 1600s?
1500s.
1500s. So from the 1500s until now, you know what took them 400 years to do?
Create Hitler?
No, twinkle lights. It took them all that
Oh,
time to create twinkle lights.
oh boy. Well, they've got them now. All righty. What does the singer ask for? Boy, let me rephrase this. What does the singer ask for a deed to in the song Santa Baby?
Oh my God. A deed to a new house. I don't know, man.
Okay, I'll tell you something. I never knew that song existed until I was watching SCTV, and they had a cross-dressing fat man singing the song,
Oh,
and he
that's
was
what
supposed
we
to be.
really like for Christmas. Cross-dressing fat guy.
Well,
Yeah.
SCTV was a comedy show, and this
Yeah,
was
yeah, yeah.
Divine. This guy was supposed to be Divine. He might have been the real Divine for all I know, skating in Central Park and singing Santa Baby. But anyway, a platinum mine is the answer. That's what the singer is asking for a deed to in the song, and I have to set the explanatory information here says that interestingly Santa Baby was voted the most annoying Christmas song in a 2021
Mm-hmm.
poll. So I'm going to
Yeah.
go with
Well,
that,
I can really understand that part. You know,
especially with
Mariah Carey.
Divine.
What's the famous song that Mariah Carey has related to Christmas?
You got me.
Anyway, it's been like top of the Christmas charts for decades.
Really? Yeah.
And
I don't
this
know.
year, 2025 Christmas, it finally fell out of first place on the Christmas song chart.
Wow. Does that mean the check that arrives at her mailbox is going to be any lighter than it used to be?
Well, probably not, but
Uh, well, I will tell you one thing about Christmas music that I'm not as thrilled by it as other people. It seems like every year when I was a kid, junior high, um, and grade school, I had the flu during Christmas vacation. I would be laying in bed with a fever, ready to throw up at a moment's notice, and I just did. And I was because my favorite rock and roll radio stations had to play Christmas music 24 hours a day during the pertinent parts of the Christmas holiday. I was just tortured. So
you
I'm
know
not I'm not as excited about Christmas music as other people are.
that I am absolutely going to fall out of my chair. You know what else? You and I must have been related somewhere in the past decades because if I'm ever going to be sick,
Uh-huh.
it's during the Christmas holidays.
Yeah, boy, that just takes all the all the vim and vigor right out of you. In what modern day country was Saint Nicholas born?
Germany.
Nope. If I could make that buzzing sound, I would. Turkey.
Turkey.
At the time, his birthplace was known as Patara, an ancient seaport city. God knows what, you could tell us what the city is now, but no, you don't do that, do you? Can you finish these lyrics? God rest ye merry gentlemen. And there's
Let
another
nothing
phrase.
you dismay.
Very good. Very good. I should leave it there because
You just
I
want to make me look stupid some more,
no,
don't you?
I always like to send you out on a high. I like you to remember victory as being your closing hurrah for the episode. Okay, I'm going to say that this. Nope, I'm gonna stop it right here. You have come out a winner, sir. You have
Okay.
impressed
So
me.
when does my check come?
Oh, that's going to be. It might be there now. Why don't you go out and look for it?
Okay. I'll go right after I close out the episode, I'll go check in my mailbox.
All right, I
Because
bet
the
it's
last
there.
couple times I checked, I reached in there. You know what I found?
An alligator.
Cobwebs.
Oh yeah. Well, I can't tell you. That's probably the price you pay for not cleaning out your mailbox more often.
Well, that could be. So, we're out of time, and I'm going to go ahead and close out shop if you are, anxious or willing or agree to do that.
Oh, I'm not anxious. I could sit here all day and jibber jabber, but the audience, I'm pretty sure, is getting a little antsy, and they'd like to maybe, sneak off to the auditorium.
Well, that's probably true. So here we go, folks. Grab a pen. That might be the most important tool that you can have to close out an episode of Medicare for the Lazy Man podcast. Write down this email address, dbj@mlmmailbag.com. That's where you send a note if you want Doug to send you a link to sign up for Hey Mo. Not Curly, not Larry, but Hey Mo. Hey Mo, that's the one you want to get. He's the one that's got control of the link, and he can send it to you if you send him an email. Next, Doug is licensed nationwide to help you with your Medicare supplement planning. MedicareForTheLazyMan.com, that's where it's all happening as related to the website. We would appreciate it if you would drop a review for us. We can't get a head start on 2026 in terms of staying ahead of the travel logs, but we want to close out 2025 strong. So go ahead and do that. Find a place to drop a comment on our reviews or drop a review on our content. That would be better yet. And that would be absolutely appreciated. Last but certainly not least, thank you. You've been with us. You've been steady and somebody that we really enjoy doing business with and talking with. Thank you for doing that for the year of 2025, and I hope we can continue to count on you for 2026. Look through the looking glass and see your smiling faces, just like they used to do back in the 50s. I forget what her name was, Miss Jan or somebody
Oh,
like
every
that.
town had a different one.
Oh yeah, okay. Mine was Miss Brunhilde, I think.
Well, I
So
picked the
anyway,
wrong one. One of these episodes, I named the wrong figure. I was thinking of Ding Dong School when I said Miss Francis was the lady looking through the mirror with no glass in it, but that was wrong. She was Ding Dong School. I think I don't remember who the romper room lady was in Chicago.
well, we're going to have to do some research because we've still got some time to do before the end of the year rolls around. And this time of the year, we like to be nostalgic, and I think that would be appropriate. So anyway, thank you for joining us. We really appreciate it. You could have been anywhere else doing anything else, but you have just spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma. No more. He's living in the high ground behind Cave Creek, Arizona, in the Nosebleed Mountains, but he still has not got his private pilot's license yet. And then after he does that, he's going to go for a hot air ballooning license. So I'm going to keep him down below where he needs oxygen because he doesn't have an oxygen mask. I'm going to put him in at about 6,700 feet.
Oh, what a beautiful thing. I'll be able to breathe for another day. Well, thank you, Randy, and thank you, ladies and gentlemen. I always enjoy your company, and I'm looking forward to having you join me for our next episode very, very soon. Bye bye.